Next, we will hear from two people testifying together. Uni Blake, MS, environmental toxicologist, Independent Oil and Gas Association of New York, and Dr. Scott Klein, geologist and petroleum engineer, Independent Oil and Gas Association of New York. And I believe you have a presentation, PowerPoint presentation? Yes. To make. Okay.
We have some technical difficulties.
Okay.
So I think I'll just go ahead and proceed.
Sure.
So, Chairman Gottfried, Chairman Sweeney, and distinguished members of the Assembly, I want to thank you for this opportunity to come before you and talk to you about the health effects. As you know, my name is Uni Blake, and I'm pleased to be here to offer some comments and see how I can help you. I'm here because of my training as a toxicologist and as an environmental scientist. I have been working at building and applying regulatory processes to a number of industries, which include the oil and gas industry. And this has entailed me to work directly with some of the regulatory agencies, the EPA, the FDA, and as well as our own DEC. So that being said, I would like to help you address the question of how best to review the potential health effects of the fracturing techniques used in the oil and gas industry. I believe the how is why I'm here. After listening to some of the public statements and reviewing some of the discussions in the media and attending a lot of the different meetings, I noticed that there was one thing that was obviously missing, and that's a discussion about what is called the exposure pathways. There has been a lot of information made available about the toxicity of the chemicals. I'm not going to get into that. I'm just going to dwell mostly on how these chemicals could potentially enter into a person and affect their health. So I think what's very important, what I really need to reiterate, is that the pathways need to exist, and they need to be completed before any type of health effect can occur. So the Agency of Toxic Substances and Disease Registry, which is a part of the CDC, and the US EPA use pathway analysis for chemicals that have the potential to have negative effects on people. So they do this when they're performing public health assessments or risk assessments. Results from these assessments are important in establishing how the industry can go about mitigating different processes and conditions specifically to protect human health. So again, the key is containment. Properly contained chemicals cannot create any changes in our health. I'll just throw out there like a loose example. The gasoline in our tank is a very, potent toxic chemicals. But as long as it's well contained in the petroleum tank, we don't really worry about it. So I think the key here is containment. But what brings us here today is what I call those surprises that occur, and these are those incidents. These incidents are usually related to human error or mechanical failure, such as leaky valves or hoses, or incidents involving the transportation of the fluids. So doing these particular assessments can help provide the qualitative and quantitative results that people have been asking and talking about. Since there's no environmental contamination data in New York State related to hydraulic fracturing, because there have been no such instances, an assessment of the potential health effects relies on data obtained from environmental modeling studies and data from other states where similar activities have been taking place. As a risk assessment, you design a conceptual model and you use statistical tools to model for these surprise scenarios. And in these particular scenarios, you incorporate all the physical, chemical, and biological changes that could potentially occur to the chemicals once they're released into the environment. So just a little brief up on what an exposure pathway analysis is. It's basically a way to connect the dots from the source all the way to the health effect. So the first element is actually the presence of the source. We all know that there is a source of chemicals here. And Dr. Klein will talk about more the potential source from the reservoir. I'm mainly going to focus on problems that potentially could occur on the surface. The second element would be the availability of the media to transport the contaminants. This refers to the groundwater, the soils, the sediment, the surface water, the air, and the food chain. So successful transportation through these media is determined by, again, the chemical, the physical, and biological processes that occur in this media, which is referred to as a patent transport. These processes can result in complete degradation, dissolution, or dissipation of the chemicals, making them biologically unavailable for exposure. The third element of the pathway analysis is the point of contact, which means that people have to come in contact with these chemicals. An example of a contact point that we have discussed here today is the presence of a drinking water well, where a family may draw their groundwater for drinking. And the fourth element of the exposure pathway is how the contaminants will enter the body, either by inhaling, ingesting, or injecting, which I hope nobody would do, or through dermal contact, such as inhaling dust particles, drinking the contaminated water, or physically touching contaminated soil. And the fifth element is the presence of a population. One of the reasons we are having this discussion is because I believe that the drilling moved from more rural areas where the fifth element was missing. So when you do a model exposure pathway, all these 5 elements have to be met for you to say that a pathway is completed. If one thing is lacking, then the pathway is not completed. For example, if you have a contaminated well and nobody drinks out of it, then the pathway is not completed, and we will not have any negative or adverse health effects related to that particular pathway. And so when we modeled the different pathways, we found that there were some that were completed, and some of them can be eliminated through, again, containment. The use of closed-loop systems can eliminate some of the pathways, which means if we do not use open pits and we contain all the flowback fluid in a container, then that inhalation pathway ceases to exist. The use of setbacks. If the well pad sits far away enough from the local residents, then that particular pathway will not exist. Then also the use of physical barriers. We talk about animals, walking into the pits, just trying to block the physical person from physically getting close to whatever problem it is. And then in the event of an accidental spill, the DEC has a department where they deal with the spill response program, which is designed to protect the public and people's safety. And also just something simple as rerouting the truck traffic. If you don't run the trucks through where you have a susceptible population, then you're not dealing with the issues related to the air emissions and the dust particles on the intense smaller level. So again, as I said, in the event of a completed pathway, the next step of an assessor would be to do a risk assessment or a potential health evaluation. The risk assessment establishes quantitative values for the concentrations that would be ingested or inhaled by the local residents. These calculated values are then compared to standard environmental health or dose-based comparison values. And these values have been used for a long time. They include drinking water standard levels. They include some of the ambient air standard levels. So once you compare the calculated or predicted values with these, then you can determine whether there's a risk for cancer or there's a risk for non-cancer, or on the different chemicals that have raised concern. So a health evaluation on the air emissions also would include a literature review of health effects related to workers in the oil and gas industry. A review was conducted, and it did not reveal any signs of chronic illnesses that were related to workers exposed at the well sites. Even when they did the review of workers who were exposed to levels of benzene working. And so the inference is, since the workers who were exposed to these higher concentrations for longer periods of time, it is expected that the local residents and people that belong to the more sensitive populations, subpopulations with lower actual exposure durations, were not expected to develop the chronic illnesses. So using setbacks and some of the industry best practices are designed to minimize some of these pathways. Health effects associated with hydraulic fractured related water treatment. We have discussed this a lot at our level. As far as the wastewater goes, New York State, through the DEC, have a very stringent program through the national program as well. So wastewater treatment of flowback guidelines are outlined by the DEC, and only certain wastewater treatment plants are allowed to handle frac flowback water, and they're expected to meet pretreatment standards. So, and then the health effects associated with the air emissions, I briefly mentioned that. On May 6th of this year, the Pennsylvania Department of Environmental Protection released a study where they stated that there are no health effects associated with the natural gas activities in the north central region of their Commonwealth. This region also produces dry gas, which is similar to the type of gas that we expect here. And by dry gas, I believe we mean that you don't have a lot of the other compounds beside the methane in the gas that are worrisome. One of the previous presenters talked about doing air modeling, and the DEC did do an air model study. It's in the draft supplement. The results of the modeling showed that potential air emissions exposures can be eliminated by using proper setbacks and containing frac flowback fluids. Health effects associated with drinking water. Again, this is all a part of the health evaluation. Gastem USA, which is a exploratory company operating in Otsego County, I work as a technical consultant for them. We have collected over 50 different sites of water quality as a baseline from private wells and surface waters, and we did this around a vertically fractured well in the county. The sampling started in 2008. The well was fractured in 2009, and we're still continuing collecting water samples to date. We haven't noticed any significant changes in the water quality, barring seasonal fluctuations. And I'm not sure if you're aware that this particular well was a part of the Duke study that Osborne did, Steve Osborne and Abner did. There was methane detected prior to the fracturing of the well. Actually, we have seen about 20% of the water wells in the county do have methane in them in detectable levels. And after the hydraulic fracturing that was done, we did not notice any change in the amounts of methane that was in the wells. So I just wanted to throw that in there. So then going back to what they did out in Garfield County in Colorado, they did a community health risk assessment. And what they noted was they did not notice that there was going to be a health crisis associated with the industry. And as we know, there's a lot of activity going on in Garfield County. So what they put at the end of their report was the use of best practices can reduce risk and more data is required. And I do acknowledge the fact that we do need more data to connect the dots. Somebody had raised a point that if you have somebody that's sick and there's a well going by, we do need more data to try and find where the relationship is. So in summary, and just to reiterate, the key to protecting the human health is containment and regulation. Modeled health assessments and risk assessments that have been evaluated are based on recreating potential viable pathways and affirming whether these links exist or they do not exist. If chemicals can be contained, then pathways can be eliminated and human health protected. However, there is the factor of human error and mechanical failure, and there is the potential that incidents will happen. But through risk assessment modeling, it is expected that due to setbacks, which will help natural attenuation, which is what happens to the water as it moves through the ground, and dissipation, the dilution, and a host of other biological, physical, and chemical processes involved during the transport of the chemicals, concentrations that are available at the point of contact will not be significant enough to elicit an adverse acute health effect. Thank you for the opportunity.